It's December 16th, and I've got a few updates for you this week. First of all, and this is actually over a week old at this point because Orman was our guest speaker last week. The Office of Support Services has made a donation to 5 food banks around the state as they worked with the Department of Administrative Services to close out our inventory for our central warehouse. As you're probably aware, the Department of Rehab and Corrections took their food procurement in a different direction and went with a private vendor this year. And so we worked very collaboratively with DAS to make sure that the food that we had on hand that was not sold at auction was made available to food banks in Ohio. And as a result of the tenacity of Len Mills and folks at OSS, as well as Hamid Marizi here in central office, we were able to donate a total of 664,000 servings of protein, 363,000 servings of grain, and 69,000 servings of vegetables. In total, there were 140 skids of frozen food items donated, and so thanks to everyone who helped make that happen. I know the food banks are a priority of the governor, and it was great to be able to help folks, particularly at this time of year. The second update I wanted to provide today is related to Project Dawn. You may be aware that Project Dawn is an initiative that's being undertaken in different places in Ohio to make the drug naloxone available to individuals who are at high risk of opiate overdose. Naloxone essentially reverses the impacts of an overdose so that lives can be saved in the short term and emergency responders can hopefully connect the individual with the long-term treatment that he or she needs. Dr. Moman, who's our Chief Clinical Officer at North Coast, and Alan Pyers, who leads the pharmacy department there, have undertaken a logistical pilot to connect individuals who are in our state psychiatric hospitals with naloxone if they have a co-occurring opiate addiction. So that when they leave, they have this potentially life-saving drug with them, and they could be hopefully saved by friends or family members or first responders in the event of an unfortunate overdose. And to date, in a very short period, 2 lives have potentially been saved as a result of the pilot that was undertaken at North Coast. And we're now moving Project Dawn and the naloxone as a portion of the discharge medication when indicated to our other 5 hospital sites. So I think that this is an excellent way that we're reflecting the broader mission of our department to marry the needs of individuals with co-occurring disorders between mental health and addiction services as we go forward. So thanks to Dr. Moman and to Alan Pyers for your leadership in this regard. I also wanted to mention that beginning January, we're going to be starting a new initiative here at the department. We are going to establish a mental health clinical roundtable. This will be very similar to the clinical roundtable that was established by ODATIS, and it was carried forward into the new department to focus on policy, insight from folks throughout the field in the alcohol and drug addiction services area. We're going to have a companion clinical roundtable that's focused on mental health. And both of these roundtables, as well as the prevention roundtable, will report out at our quarterly behavioral health leadership meetings. Dr. Hurst is working to establish the roundtable with assistance from LaTanya White, and we are going to be having our first meeting in January. There'll be about 20 members, and they will be reflective of providers and boards and other interested parties with a clinical perspective beginning in January. So look for more information on that. And then finally today, I wanted to mention that we continue to work to make internal changes as identified in the strategic plan based on the feedback that we received from folks within our department earlier this year. We have the sounding board, which is a spot on our e-zone where anyone can register a question or a suggestion either with your name attached or anonymously. And we have a group of folks, both management and bargaining unit staff, who make up the sounding board that actually reviews this feedback when it's provided. We now have an official charter for the sounding board members, and there are terms that are identified, and we will have folks rolling in, rolling out of the sounding board according to the charter. You can find that on the sounding board area of the E-Zone, and I encourage you to take a look at that. If you're interested in volunteering, please identify yourself to Nicole Marks, and we will contact you when a vacancy is available. So with that, I hope everyone is having a good week, and I will check back next week with more updates. Thanks.